Now we're assuming the frame has been tried in the patient and it fits satisfactorily. We're putting it now back onto the cast itself, and we are outlining it for you, the extent and the borders of which the triad will extend, so that you don't overextend the triad. You will follow the lines as we give them to you, and we will return the frame to you with this marked. You have tried it in and you're satisfied the frame fits. Having done that, we are then going to take the frame off of the cast, and we are going to block out any undercuts before we adapt the triad. Incidentally, you will use blue triad. Now we have a hot flaming spatula, and we're just putting on some wax in the obvious block out areas needed where there's undercut, so that the triad does not get hung up. We are also suggesting that we put some separating material on that stone so that the triad will not stick to it. The triad, once it's adapted over the mesh, and I am repeating, over the mesh, we will then trim it with a very sharp blade. I recommend a barred Parker blade to get a nice clean cut. I'm also recommending that the triad is double thick, the purpose of which is to support the compound when the border molding will begin. Otherwise, the compound will sneak into it, and we want a ledge to support it. Notice we're adapting the triad over the mesh, and we're going to trim away the excess with a sharp blade. So there's no need to have any extra problems with relieving it and removing it from the cast. So we're trimming it off carefully, and we'll pull it away. There's our line. Now do not worry if you're a little short. If we're short, we'll pick it up with the compound. Not a problem, but there is reasonable thickness there to support it on the ledge of the shoulder, so it does not creep into the triad itself. Once we're satisfied, we will take it off. We'll put it in the oven 3 minutes, turn it over, bring it back, and you'll notice now that the triad is an integral part of the frame. However, when we take it off, we'll notice it's rough, and it has to be trimmed and polished because it's going into the mouth to border mold. So we'll take a rotating instrument and put a nice shoulder on it and define it so that it will have a lovely area for which we can then put our heated compound on and border mold it, similarly to as you do with a full edentulous tray, custom tray. Notice we feel it to make sure there's no sharp edges. You don't want to harm the patient with it. And it's ready now to receive. Now, we're going to put separating material on here so that when we lift it off, it will come off the compound. From this point on, you will imagine this cast as the patient. This is now the patient. Remember that. So we heat our compound, twisting it and rolling it over the flame so that it will droop but not drip. We will control it by heating it, tempering it in hot water, and laying it on the shoulder of the triad. Notice we will twist it again as we do. We tempered it, and we'll now go into the patient's mouth and pick up an imprint of the vestibule. It should have a nice roll to it when we're done. Remember, never, ever take it from the flame to the patient. You will burn them. You must temper it in hot water before you place it in the mouth. Again, same routine. Twist it, roll it so it starts to droop, and we will then lay it on the shoulder of the triad. Also, remind yourself that in the event this is a bilateral distal extension, you will do both sides, obviously. Again, we're going into the patient's mouth, having tempered it in hot water. You'll border mold it with the cheek as you would a full edentulous custom tray. Again, I'm reminding you that this is the patient. We'll take it out once we know that we're satisfied we've covered the areas we need, and we'll remove it from the patient's mouth, examine it to see that the roll is itself very acceptable. Now you will notice that some of the material has creeped in. Do not be alarmed. We will trim that away. Again, twist and roll, twist and roll, twist and roll. And we will lay it on again, temper it in hot water. Now you can either temper it before you put it on the triad or lay it on the triad and then temper it in the water. But please do not go directly from the flame to the mouth. Now we're going back into the mouth. We're going to pick up the detail of the lingual flange as to where it will extend, because very essentially we need the details of the retromylohyoid area. That is exceedingly important that we capture that. We're getting a nice roll here, and we're going to touch up a little. In the event you want to add compound to compound, it must be dry. Compound will stick to itself, but if it's wet, it will not. You must have the compound dry if you want to add to it. Again, what we're doing with our finger is what the patient will do with his tongue by thrusting it forward. He or she will do the border molding for you in that fashion. Now we're getting some of the detail in that retromylohyoid space. We've covered the retromolar pad, and we're now ready to trim away the excess. Our blade that we use to cut will be sharp and hot. You will hold the blade over the flame so that it's hot enough to trim the compound. If the blade is cold, you'll drag the compound off of that triad and you'll have to redo the whole thing. You notice you get a sharp definition between the compound and the triad with a Bard Parker or any sharp blade that's heated in the flame. Whenever you want to cut wax, whenever you want to cut compound, whatever the material is, use a hot blade. You will get a sharp, defined outline of your cut, and you won't drag the compound away, nor will you tear the wax if you're cutting wax. Now this is a fairly good definition of our details of the borders of the compound that we're going to extend. We are now ready to take the final impression. We're using a special adhesive designed for polysulfide. It's a polysulfide agent, an adhesive, and that is the only thing you use with it. Do not attempt to spray it with any other type of adhesive. You must put a coating on there so that the rubber will stick inside the mesh, and we're ready to mix it. This is the base and the catalyst. The dark is the catalyst, the base is white, equal amounts. Use a very thin spatula. Don't use a popsicle stick. Don't use a spatula for alginate. It must be a very thin spatula over a pad. Don't use a single sheet or the pad will pull up. You will finish mixing when there's no more streaks between the white and the dark. When you are satisfied you have a homogeneous mix, we will now put a thin layer inside of that retromolar area where we have completed the border molding. The thin blade allows us to get inside and paint it the thickness that we want. Do not attempt to fill it up. This is not alginate. This is a form-fitting effort here, so we're not going to have too much excess coming out. Make sure that the compound is covered as well as the inside of the mesh. Once we are satisfied that we're going to take the impression, you will place it in the mouth and press only the lingual bar. Do not press the posterior portion. We're trying to preserve the space under there, which was created by the lab. So we will press on the lingual bar or the lingual plate, whichever we have, and not press directly on the posterior portion. When it's seated, we will keep our finger in place until it's set. There is no special timing. When it's no longer tacky, that's when you can remove the impression. Now we're satisfied the set took place. Remove it from the patient's mouth, and we should have a nice detail of the inside, and there it is. Nicely laid out for us. There might be a little excess on the border. That's okay. And we're ready now to pour it up and do the laboratory portion of the altered cast technique. Before we're ready to start it, we must cut away the excess where it's covering the areas that are near the abutment teeth. Those are called guide plates. We're cutting the tissue or the compound away to fully expose the guide plate. It's now exposed to itself. We can see it clearly, and we know that we're now ready to proceed with the next step. We'll cavicide it for the moment, and we're ready to proceed preparing the cast. We've outlined a diagram of the cut that we're going to make. That portion will be totally removed. We'll use a saw, a cutting saw. This happens to be one from Home Depot, which is about $6. A Dunlop saw is about $35. This cuts better. It's a coping saw. And now we've cut it away, and that area is going to be replaced with new stone. We're going to put the frame back on after we've cut these retentive designs. These are called dovetails to hold the new stone into the old stone. It will lock it in. So we simply use a rotating instrument all the way through the cast. Now it's ready to have the frame and its triad impression put back on. It's hanging out in space, but we're going to replace that entire area with new stone, which will now alter that cast, which is why we call this the altered cast technique. Before we begin, we're going to sticky wax the frame in its position so that it doesn't slump down in the back. So we'll use the sticky wax to hold it. We know it's seated in there, and we don't have to use our fingers. This will hold it well for us, and we're going to then put a matrix around the area where we took the impression, which will hold the stone. Now this is caulking cord. You can use strip wax. It doesn't have to be caulking. You can look at this as though it were strip wax strips, and we're going to place it all around the entire area that we're involved with. You can see there's a space there on the mesial part of this. We're going to plug that up, and we're going to lay it in. You can heat the wax, get it soft and malleable, and lay it in so that we don't see daylight through it. There's still a little area there, and we're going to finish it off with our sharp blade. And once we have added that on, we now have an area where the stone will be poured in and lock into those dovetails that we've created. Everything has been trimmed away. Now we know the wax won't go immediately, but we have to matrix the outside so we don't lose the pour. So we're going to soften this blocking wax in hot water. Don't use a flame. Hot water. And press it against the outer part, giving us our matrix and giving us the outside wall to hold the stone. Having cut away the excess, we're now going to make sure there is no leak by using a hot spatula and searing the entire area around. And then hold it up to the daylight so that we don't see any air through it, and we're ready to add our pour. Everything's been prepped outside and in. We're ready to now mix a new batch of stone. In this case, we're going to use resin rock. It could be regular stone, but resin rock is what we will use, and follow the directions that are given to us in the mixing proportions. Always follow the directions of the manufacturer. You do not have to vibrate this material in. We can tap it gently in as we add the new stone. You notice we're just using a little gentle tap to make sure that we don't have any obvious bubbles. This is the knife that I stole from my wife's kitchen drawer because it has a nice shape and it works very well. I suggest you guys or you girls use the same kind of a knife. Tap it in gently to fill in the entire area. We want to overfill it to make sure that it goes all over the area that we want to capture. And we're tapping it in from the top. We could also tap the sides of the cast to make sure the bubbles disappear if there are any, and we'll scrape off the excess very neatly so that it is now incorporated into the original cast. You're going to do this. Again, we're tapping the stone all around. Make sure that there are no unseen bubbles. And we are now ready to disengage all the material we've put on. First, we'll peel it away, the outer matrix. Then we will immerse this in very hot water. We're going to take the sticky wax away and release this frame. And we're going to take off the triad. Sticky wax is gone, again with a very sharp blade. And we're going to, having immersed this in very hot water, we can pull it off of the cast because that compound is soft. We'll lift it up or wedge it up with the wax spatula. Be careful, we don't want to break any teeth off of this cast. We must be very gentle with it. And there is our new altered cast. The detail is there. And the space under the mesh, which was created by the lab, will be preserved. And at the final step, we will do that and recreate that space and preserve it. By heating it with a flame, we can then take the triad, either flip it off or burn it off, whichever works well. If you're going to hold it in your hand, be careful that heat is transmitted all over the frame. You don't want to burn yourself. So keep the flame on the opposite end. This is a heated blade again, and we'll knock off the triad. We'll pull away the compound, and we'll clean up the frame, and it will look as like the day it came out of the lab. We will now place the frame on the new modified cast, noticing there's a space underneath the mesh. This must be preserved. The mesh is going to be sitting above the cast. That was created by the lab, by the relief wax it put under. And the last step that we're going to use is to put Duralay, which is a quick-setting material, an inlay material. It's a monomer and polymer, and we'll drop it through the mesh onto the stone. Therefore, we have used a separate material so it will not stick to the stone, and we'll make sure that the frame is anchored securely on the modified cast, and then mix our Duralay so that the space between the mesh and the cast is preserved. That allows for the resin to be processed underneath it, so there is no contact between the mesh and the patient's tissue, and the case will be stabilized. So we can either make a creamy mix or go from liquid to powder, dropping it through the mesh and holding it up to make sure that the red Duralay has contacted the cast itself. And we can see now that there is no daylight going through there, and the mesh has been supported. This Duralay will become an integral part of this entire partial when it's processed. We have removed it from the cast. The Duralay has hardened and is now an integral part of the entire frame, and we have preserved the mesh. That is the completion of the altered cast.